Manual Muscle Testing by NYU Occupational Therapy. Today we're going to go through some of the most commonly found muscle tests that you would find in your standard OT kinesiology class. We're glad you could join us.
Patient position. Shoulder abduction in slight flexion with the humerus in slight lateral rotation. Pressure against the anterior medial surface of the arm in the direction of adduction and slight extension.
Pressure in 3, 2, 1.
Patient position. Shoulder abduction without rotation. When placing the shoulder in test position, the elbow should be flexed to indicate the neutral position of rotation. Pressure against the dorsal surface of the distal end of the humerus if the elbow is flexed.
Pressure in 3, 2, 1.
Patient position. Shoulder abduction in slight extension with the humerus in slight medial rotation. Pressure against the posterior lateral surface of the arm, above the elbow, in the direction of adduction and slight flexion.
Pressure in 3, 2, 1.
Patient position. Shoulder flexion in lateral rotation with the elbow completely flexed and the forearm supinated. Pressure against the anteromedial surface of the lower third of the humerus in the direction of extension and slight abduction.
Pressure in 3, 2, 1.
Patient position. Adduction of the arm with extension in the medially rotated position. Pressure against the forearm in the direction of abduction and slight flexion of the arm.
Pressure in 3, 2, 1.
Patient position. Elevation of the acromial end of the clavicle and scapula and posterolateral extension of the neck, bringing the back of the head toward the elevated shoulder with the face turned in the opposite direction. Pressure against the shoulder in the direction of depression and against the head in the direction of flexion anterolaterally.
Pressure in 3, 2, 1.
Patient position. Adduction of the scapula with upward rotation and without elevation of the shoulder girdle. The test position is obtained by placing the shoulder in 90 degrees at abduction and in lateral rotation sufficient to bring the scapula into lateral rotation of the inferior angle. Pressure against the forearm in a downward direction toward the table.
Pressure in 3, 2, 1.
Patient position. Adduction and depression of the scapula with lateral rotation of the inferior angle. The arm is placed diagonally overhead in line with the lower fibers of the trapezius. Pressure against the forearm in a downward direction toward the table.
Pressure in 3, 2, 1.
Patient position as shown. Pressure against the subject's fist, transmitting the pressure downward through the extremity to the scapula in the direction of adducting the scapula.
Pressure in 3, 2, 1.
Patient position. Extension and adduction of the humerus in the medially rotated position with the hand resting on the posterior iliac crest. Pressure against the arm, above the elbow, in the direction of abduction and flexion.
Pressure in 3, 2, 1.
Patient position shown. Tester applies pressure in a downward movement toward adduction.
Pressure in 3, 2, 1.